The 100,000 Genomes Project is about sequencing whole genomes in patients with rare inherited disease, also cancer and infection. In particular, we're focused on transforming the National Health Service and making the United Kingdom world leaders in the application of genomic medicine to healthcare. We also have an ambition to generate wealth from the program, and so we are already generating inward investment with people from genomics industries placing activity here in Britain as a result of the program being present. We're returning diagnosis to the National Health Service in a number of rare inherited diseases, and when I spoke earlier I spoke about a child with immune deficiencies and fluctuating neurology that was largely in ITU for the first 4 months of their life, and then sadly they died. The mother and father wanted to have another child, so they asked us to sequence their dead child and the parents, and we discovered that there was a defect in vitamin B12 transport, a trans-scopolamine 2 deletion, and this allowed us in a second child born recently to make the diagnosis early on and to intervene, the NHS to intervene administering vitamin B12 at high dose. And this gives the possibility, though we're not yet certain, that the child will have a better life and a more normal existence. That remains to be seen. But this is an example of the diagnoses being returned. In cancer, it's much more challenging because some of the approaches that we use in cancer, taking the tumour tissue out, particularly in a solid tumour, and putting it into formalin, is damaging to the nucleic acid. And so what we've had to do is to re-engineer the process in our National Health Service to use fresh and fresh frozen tissue. And so that's happening at the present time. We are working on a range of solid tumours, but we're also working on hematological malignancies. We've got a programme where we've sequenced 150 people with chronic lymphocytic leukemia. We will be also working on acute myeloid leukemia, treatment-resistant acute lymphoblastic leukemia, and multiple myeloma. Again, using the whole genomes, deploying them alongside extant trials so that we can understand not just the drivers to the disease in the first place, but the drivers to relapse, the drivers to response, and sadly, should those people pass away, the drivers to outcomes. And around these patients who enroll, we're building an electronic health record of all their data in primary care, their hospital episodes, their outcomes, and all the registries that we have in electronic format. That is creating a very rich data set that will allow us to make other observations about the life course journey of patients with these diseases. Alongside the cancer program and the rare disease program, we're taking samples for other omics technologies. So for example, to understand gene expression, proteins, and also the metabolism of the cancer. And this will allow us to build up a multi-omic picture of the cancer, because all too often the whole genome is not enough. And in essence, we've now built a data center. We've got our sequencing center, which is based in Cambridge. It's run by a company that we're partnering with called Illumina, and we're now delivering whole genomes and reports back to patients. In essence, the ambition of the program is to create a platform for the UK being world leaders in genomic medicine, and by the end of 2017. We're working very hard to embed this in the National Health Service, and for patients who are in this program, we will look every time we make a finding to see whether there could be a drug target in that particular finding, whether there's a chemical signature that might become a medicine, or whether there's an existing medicine that's on the shelf because it was thought to be useful for another disease but actually turned out not to be. So this is transforming the NHS, and the health service itself is getting ready to adopt these technologies from when our funding runs out at the end of 2017. We will then move, as Genomics England, to actually curate and enhance the data set so we can work with companies across the world, clinicians and scientists from around the world, to make sure we maximise the global benefit of this for healthcare.